One of the most common conditions that we see here is heel pain. And there are a number of causes of heel pain, but one of the most common causes is something called plantar fasciitis. The plantar fascia is a ligament that runs along the entire bottom of the foot, from the ball of the foot through the arch and attaches into the heel bone. So what frequently happens is, as the person is walking, that ligament gets stretched and strained. If it becomes overstrained, it can develop pain. You can have pain along the course of that ligament, or most commonly where it attaches into the heel bone. And what's occurring at that level is there's a thin membrane surrounding the heel bone into which the ligament attaches. So it starts to pull that ligament away from the bone, causing pain and inflammation. Over a prolonged period of time, with that membrane pulled away from the bone, that space can fill with new bone, leading to a heel spur. It's not necessarily the spur that hurts, though, it's the pulling of the ligament. We see this in people who have a flat foot, where the foot really flattens and overstretches that ligament, but it can occur in a normal arch and a high arch where the ligament tends to be very, very tight. A similar condition can occur in the back of the heel, where the Achilles attaches in the back and can pull that membrane off the bone. That can also lead to a spur. You see here where it says Haglund's deformity, this is just an abnormal extra growth, what they call a pump bump, where the shoes can rub on the back of that heel bone because of an enlargement. But again, the most common condition is the plantar fasciitis. So with that, people will have pain in the bottom of the heel. It may be a sharp stabbing pain, a pulling pain, and they often feel it when they first get out of bed in the morning, or if they've been sitting for a while and then stand. And the reason is when you're sleeping or at rest, that foot goes into a position where the ligament becomes very tight. And when you stand up, you stretch and pull and even tear on some of the tissues. So to treat this, I generally tell people there are 3 things we have to do. First and foremost, we have to address the pain and inflammation. Now that can be with anti-inflammatory medicines like Advil, Aleve, or prescription anti-inflammatories. In some cases where it's very severe, we'll inject a small amount of steroid into the area. Steroid is a very powerful anti-inflammatory. It goes right into the source of the inflammation to help settle it down so that the body can then heal and repair itself. Sometimes an oral steroid may be necessary too. The second thing we want to do is actually help support that arch. Hold it up, stop the pull and the strain. Even if we get rid of the inflammation, if the strain recurs, the pain will come back. So we have various types of arch supports. We may do a strapping with tape temporarily. We can also use a custom orthotic in those cases. The third thing we want to do is actually stretch out the calf muscle. So as you can see, the calf muscle becomes the Achilles attaching into the back of the heel, where the ligament of the plantar fascia attaches into the bottom. If this is tight, this pulls the heel back, stretching this more. So if you think of it as one long chain, that's the weak link in the chain. But we have to stretch that calf muscle. So we give stretching exercises for that. Sometimes people need to go to physical therapy. We also use a night splint that will stretch the foot, keep it at 90 degrees while people are sleeping, so when they wake up, it's already stretched and not stiff and tight. I tell people when they first get out of bed in the morning, stretch and go right into the shoes. So these methods generally are very helpful. Probably about 93 to 94% of the time, the conservative measures will take care of the pain. In cases where they don't help, then they may need more advanced treatments. There could be something like shockwave therapy, which is similar to an ultrasound. We actually have to numb the heel, and it's a high pulsed sound frequency that breaks up the scar tissue that forms from all that tearing and helps the body regenerate and heal itself. A second procedure, which is considered minimally invasive, is called topaz radiofrequency ablation. For that procedure, you do have to go into the hospital. You're put under sedation. We place a series of about 25 small holes into the heel and then place in a small probe, and that is used in a similar fashion to the shock wave to break down the scar tissue, sort of take you back to that initial acute inflammation and let the body go through the healing stages. The final option would be surgically, where we would remove a portion of that ligament and detach it from the heel bone. We tend to do that less and less because the other methods actually are more successful with fewer complications. So generally we start with the easier things, we work our way through, but I stress to the patients too that the arch supports are going to be for the long-term control of that ligament to stop the strain, stop the pulling, so this doesn't become a recurring problem. The longer it lasts, the more it recurs, the more difficult it is to treat.